Welcome to transitioning to Medicare Part 2. Hopefully, if you're seeing this, you've already seen Part 1. Just so you're aware, if you're looking at this on a pre-recorded session, SHIP and SMP programs are not sponsored by or affiliated with any advertisers. We offer free, confidential, unbiased assistance. We don't recommend or promote any outside entities offering advice on Medicare. You are welcome to call for one-on-one appointments at our office at the number below for an appointment. SHIP stands for State Health Insurance Assistance Program. My name is Lois Romeo. I'm here as a volunteer teaching this. In addition, this is sponsored by the Carroll County Library System, and we are able to do this recording thanks to Hannah Bader. We are local help with Medicare. Again, unbiased, no cost, confidential. We do have to be fully trained counselors. We have the training and then we're tested on it. And we can offer everything from this type of education to one-on-one counseling by appointment. We can do benefit program reviews, and that can be one of several flavors. It might be a benefit program review of Medicare itself or a Medigap. It might be one that compares a Medigap, for instance, with a retiree plan. We also can do application assistance for financial assistance and problem resolution. This is available to all Carroll County residents. If you have friends in other counties that would like to have the same service, these are the phone numbers for the other counties in the state of Maryland. So what are we going to be talking about today? We're going to talk about the gaps in Medicare. We'll talk about Medigap coverage, some other ways that you can supplement Medicare, Medicare Advantage health plans, Medicare Savings Program, and healthcare fraud and abuse. So you can be on either the left-hand side or the right-hand side of this chart. If you're on the left-hand side, you're under what's considered original Medicare. That says you can go to any doctor, any facility who treats Medicare beneficiaries, which is almost all of them. If Part A is your hospital, so when you're admitted to the hospital insurance, Part B is going to be all other medical other than Part D prescription. So that's your doctors, your labs, your x-rays, your medical equipment, all kinds of cancer treatment equipment, dialysis. Any of those treatments will fall under Part B. Outpatient surgery, emergency room, all of that falls under Part B. You may decide you want to pick up a Medigap as a secondary to help you on the financial side with Part A and B. The other required part under original Medicare is Part D, unless you have an alternative that gives you the same coverage. That is strictly your prescription drug coverage. You can choose instead to be on the right-hand side of this chart, which would be in a Medicare Advantage plan. So that would be more like what some of you are used to with your employers. If you have an HMO and you go outside the network of doctors and facilities, you have no coverage. You pay all the costs. If you choose a PPO and go outside that network of doctors and facilities, you will pay more than if you stay in network, but you do have coverage. So an Advantage plan is going to have A and B, and most of them will also include prescription drug coverage. If you are under a Medicare Advantage plan, you may not be sold a Medicare Supplement insurance as a secondary, and you may not pick up a standard original Medicare Part D prescription plan. So in 2024, we're going to talk about what your premiums under original Medicare, so these are nationwide numbers for your premiums, deductibles, and copayments. As we talked about in the previous presentation, most people do not pay a premium for Part A, and that's because either they or their spouse, while they were actively employed, worked for at least 40 quarters of work and paid into FICA. Once you have Part A, if you're admitted to a hospital, which is what would fall under Part A, you would be responsible for $1,632. That's not under observation, emergency room, outpatient surgery. This is if you're actually admitted to the hospital. After that 1632, you have 60 days of coverage in a benefit period. You would pay $408 per day if you need another up to 30 more days in that benefit period. And you pay $816 per day if you need more than that in that benefit period. You are then working on your 60 lifetime reserve days. You might use 10 of those this year and not use any for 5 more years, and then maybe use 10 more. But once those 60 lifetime reserve days are gone, they're gone, okay? And after the 150th day in a benefit period, you're responsible for all costs. If you're admitted to that hospital for at least 3 days, not counting the day you get discharged, and you had to go to a rehab type center, then you will have 20 days without a copay at that rehab center, or up to 20 days. And after that, over the next 80 days, you would pay $204 per day. The benefit period is defined by when you last got out of the hospital or the skilled nursing facility. If more than 60 calendar days have gone by, then you would start a new benefit period. If you start a new benefit period, you pay that $1,632 again, the deductible, and you start your day count all over again, which is why not that many people are hitting the 61st or 90th or 91st or 150th, because that's going to be a really, really serious, drug-induced coma or, long-term kind of stay at the hospital. So I'm going to give you an example to make the hospital part clear. Please, I hope you never do this, but if you went for 10 days in January and came out, did the same thing in February, March, April, and May, you're still in the same benefit period, and you are working, you've now used 50 of those 60 hospital days. However, if you went in for those 10 days in January and came out and did not go back in until May, more than 60 calendar days have gone in between, and now you will start a new benefit period. So you will pay the 1632 again and start your day count all over again. So that's Part A. Part B is medical insurance. So again, outside of hospice and being admitted to the hospital and the skilled nursing facility and a little bit of home health, your medical expenses are going to fall under Part B. So again, doctors, labs, x-rays, cancer treatments, dialysis, durable medical equipment, outpatient surgery, emergency room. All of that falls under Part B. So that's the part that most people deal with more often. Once you have Part B, if you're taking Social Security, they will automatically take $174.70 per month out of your Social Security before you see it. Unless you make more than certain amounts, which I'll show you later in the presentation, you might be income adjusted upward. If you're not yet taking Social Security, that would get billed by the quarter, but you can go back and ask that you get it monthly, because for the quarter, it's going to be 3 times the $174.70. You have a Part B deductible. So the first $240 that you spend on doctors and labs, et cetera, in the year, you'll be responsible for. After that, Medicare pays 80%, you're responsible for 20%. Unless you go to a doctor or facility that does not accept assignment. That means they haven't agreed to the Medicare rate. If so, they can charge up to an additional 15% charge above what Medicare allows. So let's say you had a $200 bill from the doctor, but the Medicare rate is $100. Medicare, if you've already done your deductible for the year, Medicare will pay 80 of that, you pay 20, unless you go to someone who does not accept assignment. They could charge in that scenario up to another $15. They still have to work off the Medicare rate, but they can charge more. So what are your out-of-pocket costs with original Medicare? Well, that depends on a whole lot of factors. It depends on the type and frequency of healthcare you need. It does depend on whether your doctors accept assignment, and you can ask that question up front. They'll be able to tell you. So some people just avoid that by avoiding those doctors. It depends on whether you have other health insurance coverage. So what is a Medigap? A Medigap or Medicare Supplement insurance policies are sold by private companies. They are designed as a financial vehicle to fill the financial gaps in original Medicare. So they are designed to pay for deductibles and or 20% coinsurance. They are standardized plans. If you pick a given plan letter, it is going to be equal as far as what it covers, no matter what company in the state of Maryland you get that from. Their costs will be different because it's based on the amount of claims they've paid out and et cetera. And how large their size of claims and everything else. But they have to cover exactly the same things. So in deciding whether a Medigap policy is right for you, then, yes, they can lower your out-of-pocket costs. They do have a monthly premium payment, and you can only get one of these with original Medicare, Part A and B. But you may not need one. So if you have other health insurance as a secondary, so most government employees do have a retiree plan. But if you have an employer retiree plan, FEHB, state of Maryland, counties, that type of thing, TRICARE, VA, Medicaid, COBRA, all of those will normally say you're not going to need a Medigap because you already have something that backs up original Medicare. But if you do want a Medigap, these are the plan types you can get. If you are under 65 and disabled, you may only buy a plan A or a D. Those are the only plans available to you. They tend to be quite expensive, particularly the D, because they are paying out more claims associated with disabilities. If you are disabled, if you're in that situation, when you turn 65, you're going to get a guaranteed issue rate period to look exactly like every other 65-year-old and can pick any of the claim types. So just for reading this chart, if you look down the left-hand side, those are the copays and deductibles we talked about on the prior chart. If you go across the chart, I'm going to talk to column G and column N, only because they're two of the most commonly chosen plans. So if there is an X in the row, that means that plan G will pay 100% of that particular deductible or copay. So you'll see that the only thing a plan G does not cover is the first $240 Part B deductible in the year for your doctors or labs. You'll notice there is not an X in any one of the columns for that, because unless you were 65 before 1/1/2020, you cannot buy a plan that covers that $240. So if you pick a G, it will be your most expensive premium, but it's also going to give you the broadest coverage. If you pick an N, which is another commonly chosen one, you will then look a little more like some of the employee plans in that you would pay up to $20 if you go for a doctor's visit. And as you notice, it's highlighted down below in the footnotes. You'd pay up to $20 for a doctor or a facility charge. You would pay up to $50 for the emergency room if you are not admitted. If you're admitted, you don't pay that. The other difference is if you go to someone who does not accept assignment, your 20% would get paid for, but you would be responsible for any excess charges, anything up to the 15% extra they could charge you. Another one that has become more popular as folks have assets to the side sometimes, like 401ks, etc., is the G high deductible. So with the G high deductible, think of it as more catastrophic coverage. So in a good year, so any year on a G high deductible, you're going to pay significantly lower monthly costs for your coverage. In a year that you are healthy and don't do a lot of visits, you're going to come out significantly ahead financially on a G high deductible. But what you do know is that you will be paying all the deductibles and co-insurances we showed on the prior chart up to $2,800 before your policy is going to pay anything. So it's really designed to pay if you have a lot of expense, meaning you know your upper limit is going to be the $240, the Part B deductible, plus the $2,800 in a year that you have, for instance, maybe 2 different visits to the hospital 6 months apart. If you are admitted 2 different times, that would have been $3,200. Well, you'd pay $2,800 of it, unless you've already applied some through other visits. So it's a way to ensure you have an upper limit that you would spend, but on your better years, it's costing you significantly less. So how do you find the right Medigap policy for yourself? You can go to Medicare.gov or the Maryland Insurance Administration site. I would highly recommend going to the Maryland Insurance site because it will show you the premiums as well as your choices, whereas the Medicare.gov site is only going to show you your choices. It does not have the pricing in it. So who can buy a Medigap? First off, you do have to have Medicare Part A and B. These are individual policies. Spouses must buy, they have to buy separate policies. Some cases, one spouse will have a secondary through employer and retirement, and the other may not, so you can either, whatever you do is individual. However, some companies do offer household or spousal discounts for choosing the same company for Medigap. What is medical underwriting? So medical underwriting is where they would review your health status and medical history. If you sign up during your personal open enrollment period, there is no medical underwriting. You have something called guaranteed issue rights. So when's the best time to buy a Medigap? It's during your Medigap open enrollment period of guaranteed issue rights, for several reasons. One is because you do not have to answer any medical questions. And if you want a policy, they have to offer it to you. They have to give it to you, actually. So your personal open enrollment period is the 6 months beginning when you are 65 or older and enrolled in Part B. This is one of the reasons that if you're still actively employed, most people do not pick up Part B because they don't want to kick in their guaranteed issue right period. It's also the first 6 months if you're under 65 and have Part B, you can pick a plan, again, only A or D, but you have that guaranteed issue rights. Again, if you're disabled and had that happen, you do get a new Medigap guaranteed enrollment period with guaranteed issue rights when you turn 65. So changing Medigap policies after your Medigap open enrollment period or after your guaranteed issue rights, you can apply for a Medigap at any time. Companies can require medical underwriting at that point, and you can be turned down or charged more. So you wouldn't want to cancel a current policy until you know you have a new one. The Maryland legislature did a really good thing for Maryland residents effective July of last year, and that's a new yearly guaranteed issue right period. So it used to be you kind of picked it, you had it for the rest of your life pretty much. Whereas now, every year on your birthday, for the 30-day window starting the day of your birthday, you have the opportunity to change your Medigap plan without Medigap underwriting once per year You have to already, number one, be enrolled in a Medigap to utilize this. And you can only change to a plan of equal or lesser coverage. So again, just be aware you cannot move up to a more comprehensive coverage or sign up for a Medigap if you don't already have one. So with that birthday rule, again, these will make these companies, I think, very competitive on the out years. If you look at this chart, it's explaining to you, so for instance, if you go down to a plan G, you can pick up almost every other type plan because you've got the broadest coverage. Whereas if you pick an N or a plan G with a high deductible, then you have to pick another plan that's that plan G with a high deductible or the plan N. But this shows you what would be lesser or equal plan. So there are a few additional times where you get guaranteed issue rights for not 6 months, but for 63 days. If you have original Medicare and the employer group health plan pays after Medicare pays, and that plan is ending. If you have a Medicare Advantage plan that leaves the county, because those are offered by county, and we have had that happen since I've been volunteering, you get a 63-day period to pick up a Medigap. If you dropped a Medigap policy to join a Medicare Advantage plan for the first time, if you've been in that plan for less than a year and you want to switch back, you can. And again, that's a one-time sort of offer there. If you joined a Medicare Advantage plan when you were first eligible at age 65, and you want to switch back to original Medicare within the first year, again, you can do that. The link below gives you the table in a book that allows you to check out all the conditions that would give you guaranteed issue rights. That book is also, if you go to that book, and we have them at the office, we can give you, or you can order them online. And it's choosing a Medigap policy. It's a very useful book. I would highly recommend you reading it. I used it when I was signing up. It'll help you sort of determine in your mind, do I want a G? Do I want an N? Do I want something else? So it's really specifically designed on choosing a Medigap. The other thing you need to know about Medigap policy ratings, there are 3 types: issue age rated, attained age rated, and community rated. There's only one company in the state of Maryland that offers all their policies issue age rated, and one company that offers community rated in the state of Maryland. All the rest are attained age. So issue age rated says that if another woman goes in at 65 and I go in at 75, I am going to always pay more than that other person because I went in at an older age. So any one of these can have an across the board increase approved, but your policy won't go up just on age, just because you got older. Attained age rated, which again, most of these are, you know that your premium is going to go up automatically as you get older. And then community rated is the premiums don't depend on your age. So it's set up for geographic coverage area and can vary over time based on inflation and across the board increases. But I'm going to walk you through an example of each of these. So if you look at this, you'll see that in the right-hand corner, it's attained age. If you look on the left-hand side, there will be, and all of these are in one book or online, either one, and we can give you the book. We have them at the office. We can mail them out to you. You can stop by and get one. It's going to have how you get in touch with that company. You can do it by phone. You can do it through email. But this is telling you that this is an attained age, so it will definitely go up with age. So let's just look for an example at a G, a high G, and an N under female preferred. You will be looking at preferred if you are buying during your guaranteed issue right period. So you'll notice a G at 65 for female preferred is 198. By the time you get out to 85, that's 353. And this, plus there can be across the board increases in here. A high G, as you'll notice, is $161 less at 65, and it's, significantly cheaper than that. It's $380 less, I'm sorry, $280 less per month by the time you get out to age 85. This is why high G has become popular for people that are very healthy. If you look at an N, it's going to fall somewhere in between 124 at 65 up to 228. So this gives you an idea of how an attained age policy would work. If you look at this company, this is the issue age, one that offers all of their plans as issue age. This time we'll look at male non-tobacco. You'll notice right off they do not offer a G high deductible because each company can choose which plans they want to offer. But a G for a male, which is going to be more expensive typically than females, at 65 is 178. If you go in at 65, you are going to be 178 plus any across the board increases. However, if instead you went in at 75, you're going to be 284 plus any across the board increases. You'll again notice the N is cheaper. Let me give you an example where you may or may not want to go with an N. If you're already doing dialysis 3 days a week, that would be $20 per visit copay on an N, or up to $20. If you're under a G, you'll see that per month, you're very quickly going to spend a whole lot more on that plan N than you would on a G. So that's just one example that might be some of the reasons you might pick a G versus an N. Okay, here is another example. And this, I want to point out a couple things. It's community rated, the only company that does that. You'll see that there's a separate table for male and female. There is a separate table if you're under 65. But for anybody over 65, if you're doing it during open enrollment, you're going to go with the base rate that's listed here. You'll also notice at the bottom, there's a footnote that tells you a whole lot about this. And that's because if you look at a G, for instance, for female non-smoker, it's $255. That looks very expensive compared to others we've looked at. Well, that's where you need to read the footnote, because anybody who enrolls within 6 months after their 65th birthday is eligible. It could be their 65th birthday or their Medicare Part B effective date, sorry, whichever one's later. They're going to be eligible for an early enrollment discount program. So at age 65 through 68, you're going to take 0.61 times that 255, meaning because it's got a 39% discount. That's going to put it right in the range of some of the other companies we were looking at. What they do after that is it's not that they change the rate unless there's an across-the-board increase, but what they do is take away 3% of the discount at each year, up through age 81, and then you're going to be paying the base rate after that. The other thing that you should notice down below is that there's a 10% multi-insured discount. So if two of you in the same household or spouse have certain policies through that same company, you're going to get a 10% discount. So it's very important you read the footnotes as you look through these. So how much is your Medigap going to cost? Can depend on your age, which company you choose, the type of policy, so that's your issue age versus attained age versus community rated. It'll depend on your health if you're not during a guaranteed issue right period, and it'll depend on the plan letter you pick, the G versus the N. And the booklet we have, that's printed out, we can, again, mail to you. You can stop by the office, pick it up, or you can look online. It is an important decision. You want to compare the companies and their costs, figure out what you believe is best for you. We can we can enroll you in either drug plans and or Medicare Advantage plans. We can explain these to you, but we cannot enroll you in this. You need to contact the insurance company directly. So how can you enroll? You can do it on their website. Most people, especially if they're in guaranteed issue rights, do it by calling the plan. And again, you can call us just for explanations, but we won't be doing the enrollment for you. So let's flip to the right-hand side of this chart. Again, that's a Medicare Advantage plan. So this is really an alternative way. It's a different cost model, an alternative way of getting your Medicare benefits. You're still in the Medicare program. You still get all the Part A and Part B services. You cannot be sold a Medigap as a secondary if you have an Advantage plan. These, again, are run by private companies. It's a cost-sharing model. Your monthly premiums and co-payments are co-insurances for each service. You have out-of-pocket limits, which you don't have. In original Medicare, you only have out-of-pocket limits if you've made certain choices over there. If you have just original Medicare with no Medigap as secondary, then there is no such thing as an out-of-pocket limit. There are geographic limits here in the Medicare Advantage plan, so that's where we said there'd be a network of doctors and facilities. Many of them will require a referral to see a specialist. But again, you can get some extra things like vision, dental, and hearing. Prescription drug coverage is included in most, but not all. You can sign up for this when you first join Medicare. You can review it, and we recommend it just like we do for drug plan. Recommend during annual enrollment period, October 15th through December 7th, that you look through and make sure this is still the best plan for you. There are some special enrollment periods, but you should view this every year. In 2024, these are the companies that can offer you in Carroll County these plans. The ones below the line are for folks who are dual eligible special needs programs. These are folks who are at a Medicaid level of income. So the other chart I showed you is a national chart for original Medicare. This is just a little cheat sheet that I make up for us to be able to give you something comparative to this. You'll, in the packet, we have all the, we can mail out to you a set of these charts that include all the different choices, but I just want you to understand how to read the chart. So I chose the Medicare PPO Advantage plans because for people who pick Advantage plans in Carroll County, that's the most commonly chosen. And there are only two that offer them in Carroll County. That's Humana and Johns Hopkins. The pink, you would only pick that if you have alternative drug coverage that is comparable to creditable coverage that's comparable to Medicare, such as you might get your drugs through the VA, that kind of thing. So I'll just go across the top row for a moment. If you were to pick Humana Choice, then you would have a $33 premium, and that's all associated with the drug side of things. If you look down the list, that can range anywhere from $33 to $120. All of these PPOs have no deductible on the health side, but a couple of them do have a deductible on the drug side. Maximum out-of-pocket. So this is what I was talking about before. If you're under a Medicare Advantage plan, if you stay totally in network on the Humana Choice, for instance, If you've incurred copays and deductibles of $75.50 in the year, they will now pay for everything on the medical side, um, in network. You know, you've done your max out of pocket. If you've been a combination of in and out network, that number would have to be up to 10,000. You can see that varies by plan. So if you go down, for instance, the Hopkins ones, those are 75.50 and 11,300. The model for inpatient, if you're admitted to the hospital, on average, and this is just sort of averaging across Humana and Hopkins, you're going to pay about $300 a day. So, and you're going to pay it per day up through the first 6 days. So if you only go in for 3 days, instead of paying the $1,632 you did under original Medicare, you'll pay $900 as your starting point. On the other hand, if you go in for 6 straight days, then you would be responsible for $1,800, which is going to be more than the $1,632. So again, that's if you're in network. If you're out of network, you're going to pay anywhere from 30 to 50% of the cost. For going to see your primary care, if you look down the list, you'll pay anywhere from $0 to $5 at the primary care, and specialists will cost you anywhere from $40 to $50 per visit in network, and then 30 to 50% out of network. This is just the back of those same charts, and this is just giving you a flavor for emergency and urgent. There is no such thing as out of network on emergency and urgent. They have to treat you. But the rest you'll see there's always an out of network. This is showing you HMOs. And the main thing I'll point out, because you read the chart exactly the same way you did the last chart, or 2 charts ago, actually. The other big difference is you'll see NA under max out of pocket. That's because there is no upper limit on what you could spend if you're out of network on these HMOs. And you'll also see 100%, and that's because the 100% is your cost if you're out of network. Okay. Other than that, you read this exactly the same way, and the pink one is the one that has no drug coverage with it. And you'll see we have all these different variations on the theme. These, the ones that you see labeled DSNP up top, that is for special needs programs. And again, those would be folks, you'd only be eligible for that if you were at a Medicaid level of income and assets. Okay, so if you have gotten your Medicare card, then one of the things you're going to want to do is set up a My Medicare account. You can either do it or we can help you do it. You do it out on Medicare.gov, and that gives you access to searching any questions you need answered from Medicare, to talking to someone, etc. It's your useful source of information. These are the kinds of things you can do out there. You can manage your prescription drug plan. So as things change, you can change it, and other personal health information. You can view your Medicare claims and your Medicare summary notices, and please do. You can figure out, you can ask questions and search and find your eligibility, entitlement, and preventative service information. You can also check your health and prescription drug enrollment information. If all of a sudden something looks funny to you, you can go determine, well, is it showing the plan I'm supposed to have? Have I met my Part B deductible? Those kinds of questions. And then just general questions under the search of, is this covered by Medicare? If you're like me and don't like a lot of paperwork around, then you can choose, if you want to get all your Medicare summary notices, etc., all electronically versus having them mailed to your house. So this is just a high-level chart that compares original Medicare versus Medicare Advantage. I believe I've touched on everything that's out here. And it's just a good summary for you as you're trying to decide through, which way do I think I want to go with this. So for Medigaps and health plans, you can go to the Maryland Insurance Administration. And this is just showing you, that you could get to the supplements and all. You can go to medicare.gov, or you could call the SHIP office, 410-386-3800, or you can call Central Medicare. So any one of those would be ways you can get some more information. And again, if you're trying to look for pricing for the Medigaps, go to the Maryland Insurance site or get one of the books from us. The other thing to look at is whether or not you qualify for a Medicare savings program. You'll see that, depending on what your income is, whether you're individual or married, and what your assets are involved in determining whether you're eligible for any of these. The first three down the left-hand side are federal programs. They interact with state programs in many cases, but they are federal programs. For the first two, those are federal programs designed to help on the medical hospital side. So if your income is lower than what you see in the column there, and your asset test is lower than what you see, then the first one you're going to be a QIMBY qualified, which means it's very similar to Medicaid. You're going to pay, it's going to pay for you or help you Part A and Part B premiums, deductibles, and co-insurance. Just to separate asset from income. So if you have a 401k or 403b or something like that, and you take money out of that, the distribution gets counted as part of your income. The asset is what's sitting in that 401k to start with. If you qualify for QIMBY or SLIMBY, then you automatically qualify to get some help on the drug side. So that's Social Security Extra Help. You'll hear it called Extra Help or LIS, Low Income Subsidy. You'll notice that that's got a little higher asset test. This is not, the assets do not include your home, by the way, or your car, your vehicle, your home, or certain burial expenses. But you can have higher assets and higher income there. You might qualify for extra help even if you did not qualify for QIMBY or SLIMBY. You could just get help just on the prescription side. The last one you see on this chart is the Senior Prescription Drug Assistance Program, SPEEDAP. There is no asset test on this. And as you can see, it's significantly higher income numbers as well. That's part of, but both are reasons that we have a lot of people in Carroll County on this program. It will pay up to $75. Now remember, that's on each of you because your plans are separate, a Part D premium. So you might, if you have a premium of 30, it's going to pay the 30. If you have a premium of 75, it's going to pay that. And sometimes the higher premiums, this can really give you a big help because the companies that have the higher premiums are typically going to have lower costs when you pick up the drug. The other plus of this is that if you got a prescription for something that's not on the formulary partway through the year, you could actually change prescription plans one time outside of open enrollment. So we're going to switch gears now to Senior Medicare Patrol. It's estimated that Medicare loses $60 billion each year to fraud, errors, and abuse. The SMP program is designed to detect, prevent, and report that fraud so that we can eliminate it, find out what they're doing, change it up, go from there. So step number one is protecting yourself from Medicare fraud and abuse. So treat your Medicare card like you would a credit card. Keep it private. You're only going to share it with your doctors or other Medicare providers, as well as if you call Central Medicare or you call us, because that's how we get to your records. Do watch out for identity theft. If you've got things showing up you're not expecting, do a double check with the doctor's office. And do be aware Medicare is not going to call you. You'll get all kinds of calls trying to make you think it's Medicare. It's not. You can hang up on anybody you don't recognize. Medicare, the only time they're going to call you back would be if you call the central number and it says that there's going to be a 2-hour wait time. Would you like us to call you when you're close to your appointment? Going to be picked up. That way you don't have to sit there the whole time. But you know that you've initiated the call to Medicare in the first place. Do review your Medicare summary notices and other statements. So, figure out, are there any services you didn't receive, any double billing, things not ordered by your doctor? A perfect example, when as COVID was so rampant, people were getting all kinds of COVID tests showing up at their house that they hadn't ordered. Or they were seeing a bill on their MSN that included COVID tests they had never seen and never ordered. So, those are the kinds of things that can help shut down some of that fraud and abuse. So it might be a couple different things. You might not have received a service. You might have already seen the billing for that on the previous month. Then you go back and check and say, oh, wait a minute, it's 2 different parts of the same visit. Or you might say, that one's already paid. And then, keep an eye out for services not ordered by your doctor. If you find discrepancies, the first thing you can do is call the provider, because it might be a keying error of some type. If that's not the case, then you might want to gather information and documentation. Then once you've done that, you can contact SMP. That would be either ourselves or the Central Medicare number. And again, it's going to be free and confidential. We can help determine whether this looks real or not. Again, we are SHIP and SMP. Kristen Harvey is the one full-time employee there. She is the one who sets up all of our appointments. You can contact her via phone and or not text. So we are free local help for people with Medicare. I told you earlier in the presentation that I would show you income adjustments. If you make more than certain amounts, you are going to pay more than the standard fees for your Part D and Part B premiums. Depending on how your tax is filed and what your gross income is will determine what you would pay. So for instance, if you are filing a joint tax return and that gross income is $206,000 or less, then you're going to pay the monthly plan premium. If it is more than that, you're going to keep working your way down the table, and you could be paying up to $81 more than your plan premium. So that's just an awareness thing. Now in Part B premium, as you can see, there's still the tables. It's set up essentially the same as the last chart. But you could be paying, instead of $174.70, you could be paying almost $600 a month. So again, it's trying to even the playing field as much as possible. I'll also note up at the top, it's based on your income that was filed 2 years earlier. So if you've had a dramatic change in your income, you can do an appeal to Social Security to explain why you believe you should not have to pay that it should be adjusted for your current income, such as retirement, or you had some strange thing happen in that go round 2 years ago. At this point, we would normally, if you're on the calls, we would allow you to ask questions. And we would appreciate it if you, you know, take a moment to let us know how we're doing. You can do it through the QR code or the email. Please note the presenter's name, date, and time of the presentation. So my name is Lois, Lois, last name Romeo, Romeo. There are also paper copies available at the in-person presentations or by request. Thank you for taking the time, and thanks, Hannah, for being here with us and monitoring the recording.